Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that surprises a lot of patients. Why your radiologist wants to see your old mammograms before reading your new one. If you've ever been asked to bring records from a previous imaging center or noticed a delay while your clinic tracks down old films, there's a good reason for that. Comparing today's mammogram to yours from 1, 2, or even 5 years ago is one of the most powerful tools a radiologist has. Here's why. Breast tissue is not the same from person to person, and it's often not even the same from year to year in the same person. Some people have naturally dense tissue that looks like a lot of white, cloudy areas on the image. Others have more fatty tissue which looks darker. Within all of that normal variation, small spots, calcifications, or areas of tissue thickening can show up that might look a little unusual on a single image, but mean absolutely nothing once you see them side by side with last year's scan and notice they haven't changed at all. Think of it like checking a photo of your backyard every year. If there's a rock that's always been sitting in the same spot in the same shape, you don't need to worry about it. But if something new appears, or something that was there before starts changing shape or size, that's what draws attention. Radiologists are doing something very similar with breast tissue. Stability over time is one of the most reassuring signs in all of breast imaging. This is also why the very first mammogram someone gets is sometimes harder to interpret than later ones. Without a prior image to compare to, the radiologist is essentially starting from scratch, learning what your unique normal breast tissue looks like. That's part of why sometimes a first mammogram leads to a callback for extra pictures. It's not necessarily because something is wrong, it's often just to get a clearer baseline picture so that future comparisons are more accurate. Once that baseline exists, each future mammogram builds on it. The radiologist can look for two main kinds of changes. The first is something brand new that wasn't there before. The second is something that was already there but has changed in size, shape, or density. Both of these are more meaningful findings than something that has simply existed unchanged for years. This is also why it matters to try to get your mammograms at the same facility whenever possible, or at least to make sure your images can be sent to wherever you're being screened next. Digital systems today make this easier than it used to be, with many centers able to pull up prior images electronically. But if you've moved, switched insurance, or changed clinics, it's worth asking how your previous records can be transferred or accessed. It's also worth knowing that even without prior images, radiologists are highly trained to evaluate a single mammogram on its own and identify anything that needs a closer look. Comparison is a valuable extra layer of information, not the only tool they have. So if older images aren't available for some reason, that doesn't mean your screening is any less thorough. It just means the radiologist is relying a bit more on their expertise in reading the single image in front of them. So here's the practical takeaway. Whenever you can, try to have your prior mammograms available for comparison, whether that means going back to the same imaging center or requesting your images be sent ahead to a new one. It genuinely helps your radiologist do their job with more confidence and can reduce unnecessary callbacks for extra testing. And if you ever have questions about your own mammogram results or notice any changes in your breasts between screenings, the best next step is always to talk with your own doctor who knows your history and can guide you through what it means for you specifically. Thanks for spending this time learning with me. Take care of yourself, and I'll see you in the next video.